Thank you for joining Grand Rounds in Urology. My name is Ariana Smith. I'm a professor of urology at the University of Pennsylvania and one of the PIs for the PLUS Research Consortium. I'm thrilled to discuss the progress of the PLUS Research Consortium. And as a PLUS PI, I really want to share all the fabulous work being done in our consortium. For those who don't know, PLUS stands for the Prevention of Lower Urinary Tract Symptoms, and the PLUS Research Consortium is in its 10th year of funding from the NIDDK. In this presentation, I'll focus on the major accomplishments of PLUS over the years, and I hope this will allow our viewership to gain an appreciation for the data we generated that will be available for secondary analyses. At inception, PLUS had a vision to improve bladder health among women. The consortium quickly developed a mission and strategies to get us there, including creating infrastructure for community engagement in our research and for inclusivity of populations underrepresented in research, including sexual and gender minorities, ethnic and racial minorities, and women young and old. The consortium has accomplished a great deal with over 63 peer-reviewed publications. We developed and published a definition of bladder health and a conceptual framework to guide bladder health research. We performed qualitative research to hear women and girls' voices, and we developed and validated an instrument to measure bladder health called the Bladder Health Scales and Bladder Function Indices. We launched a longitudinal cohort study called Rise for Health in May of 2022, with our third year of data expected by summer of 2025. We've developed a bladder symptom tracking app called Where I Go, and we continue development of an adolescent bladder health instrument. The PLUS Consortium was established in 2015. We have a data coordinating center and 8 clinical research centers. The principal investigators of our research centers are listed here, and I would be remiss not to acknowledge the hard work and dedication of this strong group of leaders and all of our consortium members and the high quality and quantity of work that we've produced. Our consortium was built with a vision of transdisciplinary team science. We have a collection of disciplines represented among our over 50 members, including prevention scientists, measurement experts, qualitative research, geriatricians, adolescent health experts, and others. Starting from the beginning, we first developed a definition of bladder health. Bladder health is a complete state of physical, mental, and social well-being related to bladder function, not merely the absence of lower urinary tract symptoms or LUTS. Healthy bladder function permits our daily activities, allows us to adapt to short-term physical and environmental stressors, and allows us to have optimal well-being during travel, exercise, social and occupational, and other activities. Our next accomplishment in the PLUS Consortium was development of a conceptual framework to guide our research. This framework integrates a life course perspective, acknowledging that different factors impact the bladder at different times in life. A social-ecological perspective with the understanding that health behaviors are determined by multiple social factors outside of the individual, and biologic considerations. Using our conceptual framework, the consortium developed a comprehensive list of risk factors influencing the bladder. There were more than 600 factors generated that were clustered into the 8 broad research themes shown here: toileting, physical health, pregnancy and childbirth, musculoskeletal health, lifestyle and behaviors, mental health, microbiome, and hormonal status. Across the 8 themes, 27 research questions were prioritized for study. In order to answer these 27 research questions, we needed to develop and validate a variety of measures, including a self-reported measure of bladder health, as well as novel measures of potential risk factors for bladder health. These new measures would form our toolbox for our foundational study. There was no existing measure of bladder health. The existing LUTS measures lacked the ability to measure the full range of bladder health across multiple domains and conditions. Through rigorous psychometric principles, we developed and validated a new comprehensive measure of bladder health. Gaps in our knowledge and understanding were filled with one of our first studies, a qualitative study called SHARE that utilized approximately 30 focus groups across 7+ research centers to explore women and girls' experiences, perceptions, knowledge, and behaviors related to the bladder. Several dimensions of bladder health emerged through our conversations with women and girls and are represented in our final instrument. From here, we went into cognitive evaluation and testing of the instrument. This produced the 10 bladder health scales and 6 bladder function indices shown here. Each scale in the first column is made up of a few questions that measure an individual's perception of their bladder and how well it works in various situations. The 6 bladder function indices listed in the center column measure how well the bladder functions. The instrument also captures adaptive or coping behaviors related to the bladder. The total number of items is 46, producing a scale of 0 to 100, with 100 indicating perfect bladder health. A general perception or bladder health, or what we term the global scale, has only 6 items, and this can be used alone or in combination with the other scales and indices. The new measure was validated for use and was published in 2022. Much of our work in the PLUS Consortium was going on in parallel to get us ready to launch Rise for Health in 2022. We were building our community engagement core, and we were developing additional instruments to measure novel factors such as toileting environment, bladder knowledge and belief, and self-care practices. Rise for Health was launched in 2022 to identify factors associated with bladder health and LUTS in U.S. women, and to determine the distribution of bladder health and bladder health knowledge in U.S. women using our new measure. Rise for Health is a population-based cohort study centered around our PLUS clinical research centers. We used stratified random sampling to recruit a sample of participants that were ethnically and racially similar to the U.S. population across a wide range of age. Data collection occurred either through mailed or emailed surveys. In-person assessments and specimen collection occurred in a subset of our participants. Our baseline assessment began in May of 2022, and our third assessment is in the field now. In an effort to optimize the scientific rigor, the feasibility, and the inclusion of our study, we developed this organizational structure to support RISE study development. Community engagement was at the foundation and permeated through all the work that we did. We had a participant sampling and monitoring core with a focus on novel and innovative sampling strategies, a recruitment and retention core, data collection cores, and a cross-cultural adaptation and Spanish language translation core. The study was launched in May of 2022, and the cohort enrollment included 3,422 participants. 520 came in for in-person visits. 435 contributed analyzable sets of urine specimens for microbiome and other biochemical analyses. 95 participated in a pilot study contributing both vaginal and rectal specimens. Our first follow-up was completed in the summer of 2024, and we retained 2,321 participants in our cohort. Our second follow-up should be completed in the summer of 2025, and to date, we've retained 1,924 participants in our cohort. So what did we find? 50,367 invitations were sent with a 7.9% response rate. The mean age of our cohort was 49.8 years. We did a great job achieving representative sampling, with 15.3% of our participants identifying as Hispanic, 5.9% as non-Hispanic Asian, 12.3% as non-Hispanic Black, and 62.9% as non-Hispanic White, and 2.6% identifying with multiple racial identities. There was a nice distribution of BMI and menopausal status reflecting the population. So in addition to bladder health with our new instrument, we also measured LUTS using the Learn SI10. The distribution of LUTS are shown in the various shades of purple, with the lightest across the bottom representing the proportion of the sample without LUTS. Medium purple in the middle indicating the presence of mild LUTS, and dark purple on top indicating the presence of moderate to significant LUTS. Taken together, 79.2% of participants in Rise for Health experienced at least one mild lower urinary tract symptom, while 36.5% experienced at least one moderate to severe lower urinary tract symptom. Urgency was the most prevalent LUT in more than 55% of participants, while urgency and incontinence occurred in 32.3%. LUTS prevalence in Rise for Health was similar to other epidemiologic studies. 37.5% of our participants were bothered by their urinary symptoms. 37.9% had discussed their urinary symptoms with others, healthcare providers, friends, family members, or both. But yet, only 7.1% of participants reported LUTS treatment. This highlights the large number of women who are experiencing bothersome symptoms without seeking treatment. The distribution of bladder health using our new instrument is shown here. The unadjusted score in the left column and the adjusted score in the right column. A downward adjustment in bladder health score was made if participants were using adaptive or coping behaviors such as carrying or wearing incontinence pads, toilet mapping, or staying close to the toilet. The median global perception of bladder health score was 72 out of a possible 100 points before adjustment for adaptive and coping behaviors, and 55 after adjustment. When looking at participants without LUTS, essentially determining what the new bladder health measure captures in those individuals without LUTS, scores were higher across all the bladder health scales, indicating better bladder health, as you would expect, yet the scores were not perfect. The median global bladder health score was 88 before adjustment and 82 after adjustment for adaptive and coping behaviors, thus demonstrating a range of bladder health even among those individuals who did not report having lower urinary tract symptoms. What's really interesting is that 68% of participants in Rise for Health reported using adaptive or coping behaviors related to the bladder, including 40% who reported using pads, liners, or absorbent underwear, 58% finding the bathroom everywhere they go or toilet mapping, and 3% staying as close to a bathroom as possible when away from home. And despite good bladder function, 38% of participants in the subset without any reported lower urinary tract symptoms also reported using adaptive or coping behaviors, including 11% who reported using pads, 30% toilet mapping, and 2% staying as close to the bathroom as possible when away from home. What Rise for Health taught us is that there is a broad range of bladder health ranging from poor to optimal in U.S. women. There is high utilization of adapting and coping behaviors such as using pads and toilet mapping, even among women without lower urinary tract symptoms. There are higher bladder health scores in those without LUTS, yet they're not perfect scores, which supports the concept that there is more to bladder health than just LUTS. And this may also identify a novel subclinical population ripe for LUTS prevention studies. What I showed you is just the beginning. There's so much more data coming, and we continue to publish in a wide range of journals to get our message out. We're also producing common language summaries for the lay public. We're on all the socials. The planned impact of the work of the PLUS Consortium is to lay the foundation for evidence-based LUTS prevention, promoting the overall well-being of girls and women. Thank you for your attention today.